The topic of this lecture is blood vessels. Recall that arteries are blood vessels that carry blood away from the heart, whereas veins are blood vessels that carry blood towards the heart. This means that in the systemic circulation, the arteries will contain oxygenated blood and the veins will contain deoxygenated blood. And the opposite is true for the pulmonary circulation. In the pulmonary circulation, the arteries will contain deoxygenated blood and the veins will contain oxygenated blood. The walls of arteries and veins consist of three tunics: the tunica interna, or the inner layer, the tunica media, middle layer, and tunica externa, or outer layer. The innermost layer of the wall of an artery is called the tunica interna. This consists of three parts: the endothelium, the basement membrane, and the internal elastic lamina. So we'll start with the endothelium. This is a layer of individual cells, single cells, and it's continuous between the inside of the heart, major arteries, small arteries, capillaries, and then onto veins. Also, the next layer is going to be the basement membrane. This is an extracellular matrix containing fibrous proteins such as collagen and laminin. It's a little bit elastic. It also gives some strength, and it also binds the endothelium with the next layer, which is the internal elastic lamina. So this is the outermost layer, and it contains a layer of elastic fibers called elastin. The next layer is the middle layer. It's called tunica media, and it consists primarily of smooth muscle, although there are also some fibrous proteins mixed in with that layer. So this smooth muscle is responsible for vasoconstriction, reduction in diameter of the blood vessels, and vasodilation, increase in diameter of the blood vessels. And then the final layer is the tunica externa. This is composed of connective tissue, and it serves to strengthen and protect the artery. The very largest blood vessels, such as the aorta and other major arteries that branch out the aorta, are elastic arteries. They are able to stretch as blood is pumped into them and then recoil when the ventricles relax. So in other words, during the ejection phase, they increase in diameter, as shown in this picture. So blood is flowing, of course, through the aorta and the other major arteries. But as it's flowing, it also pushes against these elastic walls, and the diameter of the aorta and other major arteries increases. Now, as soon as the ejection phase is completed, the aortic valve closes. And then at that point, the walls start to collapse inwards due to elastic recoil. And you can see here with these arrows, they're actually essentially pushing the fluid, and this continues. This is very good because it will continue to push the fluid longitudinally, and it also will increase the pressure within the major arteries. And so this is a major way that your body has to maintain blood pressure. In other words, during the time when there's no blood being ejected, you still have blood pressure, and that's because of this elastic recoil in the major arteries. And these again are called elastic arteries. Now let's imagine if you didn't, instead of having these elastic arteries, what would happen if you had copper pipes instead of elastic arteries? What effect would this have on your systolic pressure and your diastolic pressure? Think about that for a moment. Okay, I'll try to draw the idea. So we have systolic pressure and then diastolic pressure. So this is not a particularly accurate drawing, but your pressure, the blood pressure is going up and down. So of course, when the left ventricle is contracting, blood is being ejected to the later phase of that ventricular systole. And so the aortic blood pressure is high. And then later the aortic valve closes, and then we're relying on this elastic recoil to maintain the blood pressure. So then that's the diastolic pressure. So the pressure is lower. Now imagine if we had copper piping, which is very rigid. Well, the blood pressure during systole would be much higher. So instead it'd be much higher. And why would that be? Well, pressure is force that's perpendicular to a surface area. And it's given in units of force per amount of surface area, such as pounds per square inch, where pounds is a unit of force, or PSI when you inflate the bicycle tire or car tire. So imagine you increase the surface area, which is exactly what happens when you have this elasticity and the major arteries increase in diameter. This increase in surface area means that the pressure is lower because you're dividing by a greater surface area. So if you didn't have that change in diameter, then the blood pressure would be much higher. And then let's think about what would happen during diastole. Well, you wouldn't have this elastic recoil. In fact, there wouldn't be any. And so your blood pressure would then drop all the way to zero or very close to zero. So the aortic pressure would go through much greater swings than they do when you're healthy and you have elastic arteries. Now, this actually is a problem as people age through poor diet, through lack of exercise, and actually just as a function of age also. What happens is you have hardening of the arteries and they become less elastic. And so you will find in older individuals that their systolic blood pressure will be higher, and sometimes you may even find the diastolic pressure might be lower. Although there are other reasons why the diastolic pressure may be a little bit elevated even in individuals that have hardened arteries. Once you get past the elastic arteries, the next level of arteries are called the muscular arteries. They're also sometimes referred to as distributing arteries. So these are going to distribute blood to the various organs. So they're going to be a little bit smaller in diameter. They'll be less elastic, and they're going to have, in relation to their diameter, they'll have more smooth muscle. So naturally, as you move away from the heart, if the elastic arteries are doing their job, then that should essentially decrease the difference between systolic and diastolic pressure. And so by the time you get to the muscular arteries, there isn't quite as much variation between systole and diastole in terms of the pressures. But also these ones are simply they're less elastic, so they're not going to change as much in diameter, and they're more muscular. So the additional smooth muscle has a purpose, which is it helps to direct the flow of blood by vasoconstriction dilation. So obviously if the blood vessels, these muscular arteries dilate, you'll have more blood flow to a particular organ or group of organs, whereas if they constrict, you'll have less blood flow. The muscular arteries lead to the next level of artery, which is even smaller, called the arterioles. These are very small arteries that lead then to the capillaries. Arterioles have all the same three tunics of larger vessels, but the thickness of each is greatly diminished. The critical endothelial lining is intact, as you can see here in this picture. You have the endothelium, the tunica intima here, shown in this diagram here. And then you have the next layer, which is the tunica media, which consists of smooth muscle cells and some fibers, collagenous fibers and so forth. It's greatly reduced. It's going to be about 1 cell thickness or potentially 2 cells thickness. And finally, the tunica externa is there, but it's very much diminished in diameter and strength. And this makes sense because, of course, by the time you reach the arterioles, the amount of pressure, blood pressure, has been greatly reduced. So the arterioles have a very important function. They control the distribution of blood to various organs. For example, in active skeletal muscles, arterioles vasodilate, leading to a large volume of blood flow per unit time. In contrast, in resting skeletal muscle, the constriction of these small arteries and arterioles reduces the blood flow to about 5 to 10% of the maximum capacity. The term microcirculation refers to blood flow through the smallest vessels in the circulatory system, such as arterioles, venules, shunts, and capillaries. The next thing we're going to look at is the meta-arteriole. This is a short microvessel in the microcirculation that links arterioles and capillaries. We can see one here. So a meta-arteriole does not have a continuous tunica media. Remember, this is the layer that has the smooth muscle. Instead, what they have are individual smooth muscles placed at intervals along at short distances apart, each forming a precapillary sphincter that encircles the entrance to a capillary bed. So you can see, for example, here, there's a precapillary sphincter. And so blood could, when this is open, will be allowed to go through this capillary bed and then return through the venule and then to the vein. Now, so it's possible for these to constrict, as you can see here in this picture. So if you have the constriction of these precapillary sphincters, then blood will simply flow directly from the arteriole into the venule. And so this is necessary in some organs that can change their metabolic activity rate. So, for example, the intestine would want to have a lot of blood flow after a meal, but in between meals, there's really not as much need for as much blood flow, and so those precapillary sphincters may close when not actively digesting food. In addition, there's another thing we should note, which is the arteriovenous anastomoses. And these are essentially shunts which allow blood to move directly from arterioles to venules. The very smallest blood vessels are the capillaries. These consist of an endothelial layer surrounded by basement membrane, and that's it. There aren't any smooth muscles associated directly with capillaries. Because of this, they allow for rapid diffusion of various molecules. So, for example, from the blood plasma to the interstitial fluid, you can have movement of water, oxygen, carbon dioxide, nutrients, waste chemicals, things like that. Now, the capillaries, as I mentioned, they don't have any smooth muscles on their own. They do, however, release chemicals such as endothelin, which leads to constriction of precapillary sphincters and can also lead to constriction of arterioles. The endothelial cells, also the capillaries, may release nitric oxide. That's a signaling molecule that can lead to vasodilation of arterioles and precapillary sphincters. And so the capillaries, as I said, don't have any smooth muscle, but they can control smooth muscle in their local area, thereby affecting blood flow through them. Another additional point is that the blood flow through capillaries is very slow, and this is very good because it allows for additional time for exchanges of gases, nutrients, and waste. There are three different types of capillaries. They're given different names based on the degree of leakiness. There are continuous capillaries, which are the least leaky, fenestrated, which are quite leaky, and then there's discontinuous capillaries, which are very leaky. So we'll go through all three in order. So continuous capillaries are the most common type. In those, adjacent cells are very close together. These are found in muscle, adipose tissue, and the central nervous system. So continuous capillaries are characterized by a complete endothelial lining, as you can see in this diagram, with tight junctions between the endothelial cells. So recall that tight junctions are also known as occluding junctions, and these are these protein junctional complexes that prevent paracellular movement of solutes in water. Now, having said that, not all of these are perfectly tight. Now, they'll have tight junctions, and then there'll be small clefts. And so in some of these continuous capillaries, there are in fact these small clefts that essentially lead to areas. So these are intercellular clefts that allow for exchange of small molecules such as cations, anions, so sodium and potassium would be cations, anions would be things like chloride, movement of water. Also between in these small clefts, you can have the movement of glucose, hormones, and so forth. What they don't allow for is the movement of proteins. Proteins are simply too large to move through these clefts. And you can see a picture here of the tight junctions. So here's the mucus. This is just another sort of generalized, this is probably the small intestine or something. But you get a good idea of what this would look like. You have the tight junction. So you have the apical membrane. And then below the tight junction, you have the basolateral membrane, which we've talked about before. So as I said, in most places, throughout this. The tight junctions are in fact tight. They don't allow anything to move through them, but there'll be points where there's these small intercellular clefts that often do allow for the movement of some things. Okay, the tightness of these continuous capillaries actually presents a little bit of a problem, which was that sometimes it is necessary for larger molecules such as proteins to be transported across from, say, the blood plasma into the interstitial fluid, or going back in the other direction. And so for this reason, continuous capillaries are rich in transport vesicles, and these contribute to endocytosis and exocytosis. So for example, in this picture from your book, you can see examples of penocytosis, which is a situation in which you have a mode of endocytosis in which small particles are suspended in fluid, and they're brought into the cell by invagination of the plasma membrane. And then you will have a small vesicle within the cell that will contain the molecules of interest. So these continuous capillaries help to form the blood-brain barrier. So in the brain, there will be tight junctions, but a lack of intercellular clefts. In addition, to form the blood-brain barrier, the basement membrane will be thicker. And we've actually talked about this. There are also astrocytes that have these extensions called end feet that will also help to support the blood-brain barrier. And so in the brain, these structures combine to prevent the movement of nearly all substances. So that's very good, because you wouldn't want, say, for example, neurotoxins to enter the brain. This is also a very effective barrier for preventing bacteria from getting in. Now, bacteria may eventually get in, but instead of taking hours to get in, it may take weeks to months for them to actually break through the blood-brain barrier. So it is a very effective line of defense for the immune system. And so in the brain, because of this lack of intercellular clefts between the tight junctions, penocytosis appears to be the only major mode of exchange of many molecules. The next most common type of capillary are the fenestrated capillaries. These fenestrated capillaries have large pores in the vessel wall, which are referred to as fenestrations. These types of capillaries are found in the kidneys, the intestines, and in endocrine glands. And so what they do is they serve to allow for many nutrients so for example, to pass through at the level of the small intestine. The kidneys, they act as a kind of filter, so it allows certain substances to pass through. Now, I should point out, though, although they will allow things, for example, the kidneys allow glucose to pass through, and water, and many other things, and many toxins, it will not allow something as large as a protein to pass through. And the reason for that is proteins are simply too large to get through these fenestrations. The fenestration is actually quite large. The proteins could get through, but there's also a layer of glycoproteins. And those prevent the proteins from traveling through. So it's based on size, and it actually is probably most likely also based on charge. So proteins in general have a net negative charge. And so by having a bunch of glycoproteins that also have a net negative charge will have sort of a repulsive effect that will prevent them from traveling through. The least common type of capillary in your body are discontinuous capillaries. These are also called sinusoid capillaries. These have large gaps between cells. These gaps can be referred to as intercellular clefts or fenestrations, and they have kind of a Swiss cheese appearance, as you can see here. And you'll notice that in addition to that, the basement membrane is actually incomplete. So this does allow for the passage of large molecules, including plasma proteins. So where we find these? Well, they're found in bone marrow, liver, and spleen. And in fact, the gaps are so great, they look like little cavities or sinusoids, hence the name. And in addition to this, in certain places, these gaps are so large that blood vessels, cells like new blood cells, can actually enter the blood supply. So for example, this would happen in bone marrow, where red blood cells, white blood cells are being produced. Well, they need to enter into the general circulation. And so here you would have these discontinuous capillaries, and so these immature blood cells would in fact be able to enter into the circulatory system there. Likewise, in other places such as the liver, there are also going to be these types of discontinuous capillaries, and this allows the liver to process materials that are brought to it through the hepatic portal vein, which connects the digestive tract and spleen to the liver. Let's quickly summarize some of the things we've talked about. The largest arteries are also referred to as elastic arteries. They stretch in response to each pulse, and they serve thought as a pressure reservoir, right? This increase in diameter during systole essentially stores up pressure, and then during diastole, that pressure, which can be thought of as due to the expansion of the diameter of the aorta and the other major arteries, can be thought of as a kind of potential energy. It pushes, the walls push in, and that pressure is then converted to kinetic energy or energy of movement, which pushes the blood along. So you essentially get a continuous flow of blood rather than having a pulsatile flow of blood, which is what would happen if you had copper pipes, for example, instead of these elastic arteries. So the elastic arteries then give rise to medium-sized vessels. These are known as distributing arteries, or also as muscular arteries. These arteries have walls that contain a large amount of smooth muscle relative to diameter, and this allows them to contract and expand depending on the peripheral blood demand of different organs. These muscular arteries then branch into resistance vessels, which are small arteries, and then the arterioles, which you can see here. So the arterioles are small diameter blood vessels. They have all three layers, but they have a relatively small layer of smooth muscle, so only 1 or 2 cells thick. But they are the primary site of vascular resistance. In other words, when arterioles vasoconstrict, they're going to create a lot of resistance in the vascular system. When they dilate, they'll have less resistance. And then finally, we get to the capillaries. These are the smallest blood vessels in the body. Their walls are only 1 cell thick. That's the endothelium. And they're the sites of transfer of oxygen and other nutrients from the bloodstream to tissues, and for tissues to release waste products such as CO2, urea, and so forth into the blood. Next, we're going to look at the veins. We're going to start with the venules. They're the very smallest ones. So capillaries lead into venules. From there, blood is fed into medium-sized veins, and finally into the very largest veins, ending with the inferior and superior vena cava, which lead right into the right atrium of the heart. Now, the venous system is very different from the arterial system. The average pressure is only about 2 millimeters of mercury. Compare that to the mean arterial pressure, which is the mean time average of the systolic and diastolic pressure, which is about 100 millimeters of mercury. So it's much, much lower pressure. And therefore, you'd expect the walls of the to be thinner than the walls of the arteries. And you can see that in this picture. And they're going to generally have a larger lumen also, which you can see. For example, this major vein here has a very large lumen and a much thinner wall. And that's a consequence of the pressure being much lower. Now, however, the total volume of blood is actually found in the veins. So about 70% of your blood is found in the venous system and not in the arterial system. And that's partially a consequence of this really large lumen of these lumina of these veins. So let me see what else. So let's start with the venules and go into a little more detail. So the venule has 3 layers. It has an inner endothelium composed of squamous endothelial cells. It also has a middle layer that has muscle, and then an elastic tissue, and then the outer layer is going to be fibrous connective tissue. And then again, if you go to the larger veins, and then medium-sized and then larger veins, you'll also find these same three layers of that make up the walls. Now, another interesting thing that's quite different about the arteries and the veins is, remember we mentioned that the arteries can act as a pressure reservoir. Well, the veins are often thought of as being a volume reservoir. As I said, 70% of your blood volume is actually in the veins. But this can change. In other words, say you lose some blood. Well, there's smooth muscle associated with all these veins, going from venules to medium-sized veins to the larger veins. And so they can vasoconstrict. And so if you were to lose blood, then you could make up for the blood volume by having the autonomic nervous system, particularly the sympathetic nervous system, be more active. And this would lead to constriction of these blood vessels, of the smooth muscles contract. And so that would essentially make up for the loss of blood. So if you say you give blood, then you would lose a certain amount of blood, but you would expect your autonomic nervous system, and particularly the sympathetic division of the autonomic nervous system, to increase contraction of these smooth muscles, and this would lead to a very little change, if any, in your blood pressure. As I mentioned, the blood pressure within the venous system is much lower than within the arterial blood vessels. And this actually presents a large problem. If you're standing up, there's pressure just due to gravity. And so this would make it almost impossible for the blood from, say, your feet or lower limbs to get back to the heart. Now, to get around this problem, your body has kind of a clever workaround, which is that you have these things called skeletal muscle pumps. These are essentially chambers. So in other words, if you take a look at one of the major veins in your leg, it would form a chamber like this. So you'd have a one-way valve. And the way these one-way valves work is they have these cusps that are essentially pockets. So when blood flows into the cusps on say, on both sides here, they'll slam shut. So this, as long as the pressure here in this chamber is higher than the pressure in the lower chamber, then blood cannot go backward down. And likewise here, if the blood pressure is higher in this chamber, and you're not seeing the whole thing, but if it's higher here, then it can't move down into the lower chamber. So these valves essentially ensure that there's one directional flow of blood, and it's always back towards the direction of your heart. So how does the blood actually get pumped? Well, as you're walking, these veins lie deep within the body. Well, sometimes they're on the surface, but a number of them are actually fairly deep within below the skin and so forth, and between skeletal muscle. And so as the skeletal muscle contract, they actually squeeze on these chambers, increasing the pressure. And so if the pressure is higher here than the next chamber up, then the blood will flow into the next chamber, and so forth. So you'll have this sort of pattern of contraction of various chambers like this that are made with these one-way valves. And this will ensure that blood is always returning back towards the heart. The downside of this, the way your veins work in your lower, and you also have these one-way valves, of course, in the arms also. But the downside is that if you're not able to move, then you can get pretty severe edema. So if you ever take a really long plane flight, like a 12-hour flight or something, you'll find that your feet will swell up and maybe not even fit very well in your shoes. And it's pretty dramatic. And so there's a couple ways of getting around that. One is to use compression socks, as shown here. Another thing is you can do is if you're on a long plane flight and you're not able to move, is to do exercises while sitting. And if you're able to get up, then that's even better. You can get up and walk around, and this will help to push blood back up through the veins. And the problem is what's happening is if you're just sitting for a long period of time, there'll be increased blood pressure within your feet and your lower legs. And this pressure leads to greater filtration of fluid. So plasma fluid will actually exit these the arteries and veins in your feet and the capillaries, particularly at the level of the capillaries. And they'll end up this fluid will end up in the interstitial fluid, and that's how you get the swelling. Usually this is not a major medical problem. As soon as you get off the plane, you'll have a chance to walk around and you'll feel much better. Occasionally, though, there is the possibility of a serious condition called deep vein thrombosis. If you're not able to move for a long enough time and the blood is sort of stagnant, not moving, this can actually lead to the formation of a blood clot, again called deep vein thrombosis. And this could really be quite critical. You could end up in the hospital, and they could give you special drugs to break up the blood clot and so forth. The problem is the blood clot could break free, and it could travel to your lungs, or it could travel to your heart, or your brain. So there's various really terrible things that can happen once you have these blood clots. And so there have been cases where people who have been doing video games for a number of hours will actually develop deep vein thrombosis. And there have even been cases of young people dying of this. Okay, so far we have talked about the idea that you have these valves, these one-way valves within your arms and legs, and those help to promote the movement of blood back towards the heart. And in fact, you continue to have these valves all the way through the veins, but not in the arteries. And this helps to push the blood back. But there's an additional mechanism that helps to return blood to the heart, which is quite important. That's called the respiratory pump. The way this works is when you breathe, the diaphragm flattens out. So this is shown here. So this person has just been breathing out. Now they're going to breathe in. So the diaphragm, which is a flat muscle, it relaxes in this sort of state here. But when it contracts, it moves down and becomes more flat. And so this opens up, and at the same time, the chest moves up and out due to muscles that are associated with the ribs. And so this increases the volume of the thoracic cavity. Okay, so that lowers the pressure of the thoracic cavity. At the same time as the diaphragm descends, the pressure within the abdominal cavity, which is shown here, increases. Now, it turns out the inferior vena cava moves through both the abdominal and the thoracic cavity. So imagine as you breathe in, as I mentioned, there's a decrease in pressure in the thoracic cavity, and an increase in pressure in the abdominal cavity. And so this helps to push blood upwards towards the heart. And again, you also have these one-way valves within the inferior vena cava, and that prevents the blood from flowing back in the opposite direction. The next topic is atherosclerosis. The general term for hardening of the arteries is arteriosclerosis. Normally, healthy arteries are flexible and elastic, but what happens as people age, and also, due to poor diet, inactivity, the blood vessels can get harder and harder, and this may actually lead to a point in which you have restricted blood flow to organs and tissues. So it can be quite serious medically. Just to give a little bit of positive information here, because this all sounds very negative, there are actually ways to slow down the progression of the disease and even perhaps reverse it a bit. And there's many different diets, but the one diet that's been tested and studied quite a bit is the Mediterranean style diet, which is rich in things like olive oil, fish, avocado, seeds, and nuts, and so forth. And that seems to actually protect against atherosclerotic plaques. A specific type of arteriosclerosis is atherosclerosis. This refers to a buildup of plaque, which is made up of fat, cholesterol, calcium, other substances that are found in the blood. And what will happen is that over time, the plaque will begin to occlude the lumen of a blood vessel, and this reduces blood flow. Additionally, this plaque can serve as a site for thrombus formation. Thrombus is a kind of blood clot, as you can see in this picture here. Now, the danger is that the plaque plus the thrombus could occlude the blood vessel, or additionally, the thrombus could break free and then go and block another smaller blood vessel. So this plaque forms in response to damage done to the endothelial lining of a blood vessel. And there are a number of causes. This damage could be due to high blood pressure, high cholesterol, high triglycerides, smoking, other forms of use of tobacco, such as chewing tobacco, could also lead to this problem. Insulin resistance associated with obesity or diabetes, and so forth. So all of these things can lead to damage of the endothelium, which will start this process. And atherosclerosis is very important medically because it contributes to death due to heart attack and stroke. In the beginning, the first step towards atherosclerosis is the presence of fatty streaks. As shown here, these are lipid-filled macrophages and lymphocytes that are assembled at a site of damage within the tunica interna. At the intermediate stage, there's going to be a buildup of macrophages and smooth muscle. These macrophages will engulf lipid and become what are called foam cells. As the disease progresses, there'll be fibrous plaque that consists of collagen fibers, smooth muscle cells, and these will accumulate form a layer over accumulated lipids, debris, and macrophages. And as you can imagine, this structure is prone to rupture, so there may be a rupture, and then when that happens, a thrombus or blood clot will form. And then, as I mentioned earlier, the blood clot can completely occlude the lumen of a capillary or of a blood vessel, but it could also break free and then lead to occlusion of another smaller blood vessel somewhere else. Now, what's a little bit insidious about this disease is you often don't have symptoms until the artery is very, very much narrowed and clogged. So the reason for this is normally if you're just at rest and you're not exercising that much, you really don't need that much blood flow to, say, the heart or some other organ. And you may experience pain and symptoms when you try and exercise. There's evidence that a diet high in cholesterol may lead to atherosclerosis. This evidence comes from the observation that people that consume or produce a lot of cholesterol have more LDLs. LDL stands for low density lipoproteins. So remember that lipid soluble substances such as cholesterol and triglycerides and so forth, they are not very soluble in an aqueous medium. So in order to transport these molecules around the body, these types of molecules need to be associated with essentially transport proteins, in this case, a lipoprotein. Lipoprotein is a combination of proteins and lipids and so forth. And so in this case, an LDL forms a spherical structure where you have phospholipids, protein, and so forth. And so this is soluble in an aqueous medium because, of course, phospholipids, as we discussed before, are amphipathic. The heads are hydrophilic, whereas the tails are hydrophobic. And you'll notice that the triglycerols and cholesterol molecules are now packed in the middle. And so this is a very effective way for these molecules to travel throughout the blood. And these are actually useful molecules. You need cholesterol. That's part of the membrane of every single cell in your body. You need triglycerides. Those are an important source of energy. The problem is that these LDLs can also initiate atherosclerotic plaques when there's just simply too many of them. Normally, the liver takes up excess LDLs and breaks them down. But if you have a very high level of LDL concentration in your blood, they can actually interact with the connective tissue within an artery. And so these lipids will be taken up and start to create a plaque. So if LDLs are the villains, then HDLs seem to be the heroes in your body. So HDLs, which stands for high density lipoproteins, they'll actually carry cholesterol away from arteries to the liver where they're broken down for metabolism. In other words, you can get energy out of these triglycerides and cholesterol. So what these HDLs do is they take cholesterol away from the macrophages that are developing plaques. Those were called the foam cells. Um, and so then that's a very good thing. It's been shown that people who exercise will have a higher level of HDL, which is good. And there are certain drugs, such as statin drugs, that lower LDL levels and increase HDL levels. So again, that's very helpful. There's also a lot of interest in the idea of treating atherosclerosis as an inflammation disease. In other words, there's now quite a lot of evidence that one of the things that may lead to atherosclerosis is an inflammatory response. So some of the evidence comes from the fact that there's a C-reactive protein. This is a measure of inflammation. And that can be quite high in people that have atherosclerosis. So it appears like it may be a better predictor for atherosclerosis than even LDL levels, although certainly this is also a big predictor of the risk factor for atherosclerosis. So what happens is when you have inflammation, then the endothelial cells will engulf these LDLs, and these will then become oxidized LDLs that then damage the endothelium. So it's been tested, the idea of if it's really a disease that has to do with damage due to oxidation, then antioxidants should in principle work. So people have tried taking things like vitamin C and so forth, and there have been a number of studies, but so far those have showed limited success. So I just want to talk a little bit more about inflammation. Normally, inflammation is thought of as a good thing. So for example, if you have a splinter and you have bacteria that have broken through your skin and there's debris and so forth, cellular debris, well, inflammation is a good thing. You have increased blood flow, you have the release of cytokines from cells locally in the area that lead to the attraction of white blood cells. It will go ahead and phagocytize the invading bacteria and cellular debris and things like that. So in those sorts of cases, inflammation is definitely beneficial. It's very good and protects you. However, what happens is people often get chronic inflammation. And there's different levels. You can have really severe chronic inflammation due to something like rheumatoid arthritis, or you may have a much more low-level chronic inflammation. So generally, as people get older, they may have a slight level of elevated chronic inflammation. That could even last for months or years. And so this immune system essentially is responding a little too strongly. And this may be something that actually triggers atherosclerosis. And so not surprisingly, some of the things that are known to reduce chronic inflammation are things like having a healthy diet, having a healthy weight, and exercise. So all those things do tend to reduce chronic inflammation. So not surprisingly, atherosclerosis can occur within the coronary arteries. These are extremely important arteries, of course, because they're the arteries that bring oxygen to your heart cells. And they're also relatively small in diameter compared to, say, the aorta or some of the major arteries. So if you do have a problem with atherosclerosis, often it'll show up in the heart. And so what you can have is an ischemic heart disease. Ischemia is a condition characterized by inadequate oxygen, and it's often due to reduced blood flow. And the major cause of this ischemic condition would be atherosclerosis. So what happens is you get associated with increased production of lactic acid, which is because you're doing anaerobic metabolism, and the patient will have pain, which is called angina pectoris. Now, this pain may be felt around the sternum, but it may also be felt in the shoulder or even in the arm. And that's because it's called referred pain, where the location is a little bit different than the actual origin of the pain. And this is a consequence of the convergence of sensory input onto a common sensory interneurons, usually in the spinal cord. So you may feel pain in a region that's actually different from where the pain is actually originating because of the way your nervous system is designed. If this ischemia is prolonged, you can actually get to a point of necrosis. Necrosis is cell death, and so part of the heart will die. And this actually may then lead to a myocardial infarction. This is often commonly referred to as a heart attack. And so this is when you have actual damage to the tissue of the heart. And so this is myocardial infarction is a leading cause of death in the Western world. We're going to skip the section on arrhythmias detected by ECG. So far, we've talked about the cardiovascular system. Well, there's a whole other system called the lymphatic system, which is extremely important, and we'll go into a little bit more detail on that system. Recall that there are two types of main extracellular fluid in your body. One is the blood plasma. The other is interstitial fluid. Interstitial fluid is the fluid that surrounds all the cells of your body. And there are a few other types of fluid, such as ventricular fluid within the ventricles in your brain and so forth, and fluid within the joints. But blood plasma and interstitial fluid are the major ones. So what happens is that there's always a net flow of water or fluid out of the blood plasma and into the interstitial fluid. In fact, this is what generates the interstitial fluid. And so one of the main functions of the lymphatic system is to transport this excess interstitial fluid, which becomes lymph once it's within the lymphatic system, back into the cardiovascular system, into the regular blood circulation. So we'll talk about that. That's a major function. A second function is that it is involved in the transport of fats from the intestines to the blood. And then finally, it provides defense against pathogens, which are disease-causing agents. Okay, in your body, every day, all the time, there's a continuous efflux of fluid from the capillaries. And this occurs both in the pulmonary circulation as well as in the systemic circulation. So this fluid, as it moves out of is filtrate, is the term for something that filters through something. So it's filtering through the capillary wall, it becomes filtrate. And so that's the general term. And the more specific term is it becomes interstitial fluid. So the interstitial fluid is essentially being generated all the time from your blood plasma. Now, there is a difference. Remember that when we talked about the various types of capillaries, in general, almost very few of them actually allow for protein to pass through. And so your blood plasma has a very high relatively high concentration of protein compared to the interstitial fluid, which is much, much lower. And so that's a major difference. Other than that, though, they're very similar in the sense that they have very similar levels of cations and ions and other metabolic products and so forth. Now, in an adult, this net efflux of fluid from the cardiovascular system and into the interstitial fluid is about 3 liters per day. And that's quite a large volume, considering that you have a typical volume of about 5 liters for a typical adult. So if this 3 liters were to leave, you'd end up with hardly any blood plasma, right? So it can't accumulate in tissue, it has to be returned to the blood. So as I mentioned, that's a major function of the lymphatic system. So it's going to push the blood back, and it will end up back in circulation. This is a close-up view from your book showing how this works. So you have the efflux of fluid into the interstitial space from the blood plasma. It ends up entering into the lymphatic capillaries. Notice that these capillaries the lymphatic capillaries are sort of dead ends, but they're actually very loose in the fact that they have lots of clefts between the endothelial cells that make up their walls. And so this allows for the movement of protein, the movement of quite large molecules, toxins, bacterial cells, and so forth into the lymphatic system. Let's talk a little bit more in detail about these lymphatic systems. So at the first level, you have these lymphatic capillaries. They're very small. They're found in almost all the organs of your body. And so interstitial fluid will enter there. You'll have some protein. So I just said it, there's not a lot of protein. That's true, there's not a lot, but you will have, for example, your cells will create some protein that will be extruded into the extracellular environment and being taken up in the interstitial fluid. So that will end up, in fact, in this what will become lymph. The other thing that enters would be microorganisms, fats can enter, and so forth. Now, these lymphatic capillaries will then lead to lymphatic ducts, which are formed by these merging capillaries. Now the ducts have one-way valves and they have smooth muscle, so they're going to pump the fluid forward and always back up into larger and larger lymphatic vessels. And along the way, you have a series of lymph nodes, which are found throughout your body. And those will actually filter the lymph. So within there, you have cells that are involved in immune function. You have cells that are phagocytotic and so forth. They can break down cellular debris as well as bacteria. And I should mention, so the way the smooth muscles work is they work through a system by creating peristaltic waves of constriction. So these are very similar to the way your esophagus works. You have a sort of contraction in a ring-like fashion in one area of the lymphatic duct, and then the relaxation and contraction in the next section and so forth. So essentially push sort of a bolus or ball of fluid along in the correct direction. The lymph ducts merge and eventually enter either the thoracic duct, which is shown here, or into the right lymphatic duct. The thoracic duct will drain lymph into the left subclavian vein. The right lymphatic duct will drain into the right subclavian vein, shown here. Note that there are many lymph nodes, which you can see really nicely in this illustration. Okay, so therefore the overall cyclical nature of this is that we have blood plasma, which becomes interstitial fluid, which becomes lymph, which once again becomes blood plasma as we cycle around. Note also that these lymph nodes are involved in immune function. They have phagocytic cells that will remove pathogens, and so they serve as a nice filter. I just want to quickly mention that in addition to the lymph nodes, you also have tonsils, thymus, and spleen. These are also lymphoid organs. They're also sites of lymphocyte production. I mentioned earlier that the lymphatic capillaries are very porous. This allows for the movement of protein, cellular debris, bacteria, and so forth into the system. So now, unfortunately, this also has a downside, which is cancerous cells can enter these vessels. Now, recall that there's immune function within the lymph nodes, so it's possible that these cancerous cells may be eliminated in the next lymph node. But it also serves as a route for cancerous cells to get out of a local region, where a tumor is, and spread throughout the body. So this process is called metastasis, when you have the development of secondary malignant growths at a certain distance from the primary cancer site. And unfortunately, this can occur through the lymphatic system. Blockage of the lymphatic system can also lead to some other clinical problems. So for example, there's lymphedema. Recall that edema is a swelling due to an increase in interstitial fluid. So lymphedema is a swelling of the arm or leg caused by excessive amounts of fluid and protein in the interstitial fluid. The condition is caused by blockage of the lymphatic system, usually due to removal or damage of a lymph node as part of a cancer treatment. So as you can see in this picture, there's disrupted flow into these lymph capillaries and lymph ducts, and therefore you'll have a situation in which there's blockage and therefore increased fluid within the tissue or edema. So there's currently no cure for lymphedema. It can be managed, however, with early diagnosis, and you can take care of the limb with things like compression stockings. In certain tropical locations, there are mosquitoes that can transmit. They serve as a vector for parasitic nematode worm, and this can also cause lymphedema. These nematode worms will travel throughout the lymph system, and they'll essentially block the movement of fluid throughout the lymphatic system. So then this causes swelling of places like the leg or scrotum, and the disease is called elephantitis. Fortunately, there is medicine, so there's a drug that can be taken that will kill the parasites.